and help combat the concerning rise of cannabis poisoning in Missouri's youth. And I want to start today by acknowledging the guests we have with us in support of this effort. Attorney General Andrew Bailey, House Majority Leader John Patterson, soon to be the Speaker of the House, Senate President Pro Tem Caleb Rowden, DHSS Director Paula Nicholson, ATC Supervisor Mike Lira, also the Public Safety Deputy Director Kevin Bond is here, and the Director of the Missouri Poison Center, Julie Weber, who will highlight some of the concerning data trends we are seeing in youth cannabis exposures. Let me also add to this, we're not the only state facing this issue, not the only state taking action, and I think you'll see more and more states become heavily involved in trying to protect our children in our state. Each of these leaders, elected leaders, public safety leaders, and public health leaders recognize and confirm the emergency happening in our state. However, as many of you know, the Division of Alcohol and Tobacco Control was blocked from enforcing emergency rules that would have prevented the sale of harmful, unregulated, psychoactive cannabis products in facilities with liquor license. Facilities that we know represent the vast majority of where these sales are occurring in our state. And while some politicians chose to play politics instead of recognizing this epidemic and the emergency that it is for Missouri's youth, the Department of Health and Senior Services have been enforcing our executive order since September the 1st. However, DHS cannot enforce this order alone, and the lack of immediate ATC involvement is keeping us from achieving the full effect of our executive order, which at its heart is to protect Missouri children. Already, DHS has investigated nearly 60 facilities, thanks to reports from concerned moms, dads, and grandparents like myself. DHSS investigations have confirmed our fears. Product after product resembles popular snacks and candies that would be hard for me to determine that contain cannabis, let alone my 5-year-old granddaughter. And again, let me show these products to you one more time. This is what we're talking about. It is out there. We're talking this for adults to determine, and we're asking 5-year-old kids in this particular instance to know the difference between these. If you want to see another one, the Lifesaver brand. These are what's hanging in the stores side by side. And finally, Airheads, the same type of thing. And if you will notice, the packages is almost identical. They are simply targeting children of what that my grandchildren could so easily and unknowingly consume these products. It is not only concerning but frightening that my grandchildren could so easily and unknowingly consume these products. To all the Missouri parents and grandparents out there, please be vigilant and ask questions. If your child brings you a piece of candy at the store counter, make sure you know where they picked it up from, because these products are misleading and intentionally designed to mimic the real thing. I want to be clear, very clear, I have no problem with adults who know that these products, who knows these products and knows what they're getting into using these products. I have no problem with the hemp industry or the cannabis industry. But the issue remains that our kids are being targeted and harmed, and we must address the threat. As a result, today, we are announcing a new partnership between the Attorney General Andrew Bailey's office, ATC, to help identify, investigate, and remove deceptive psychoactive cannabis products from Missouri shelves. Under this partnership, a new joint task force will be established with the Attorney General and the ATC personnel. ATC will be responsible for investigating its licensees who are selling unregulated psychoactive cannabis products. The AG will evaluate referrals from ATC and use its authority under the Missouri Merchandising Practice Act to bring legal action against licensees who continue prohibited practices, which basically means that it opens the door for every business, every retailer that's selling these products across the state of Missouri. And for the people back home, I want to be very clear. I will do everything I can within the powers that I have to make sure people are held accountable for selling these products to our kids. I'm proud to be joined by the Missouri leaders today who not only recognize the threat these products pose to Missouri children, but want to help end the threat too. Attorney General Bailey has been in this fight for months, recognizing the deceptive tactics being used to market these cannabis products to our children. When the health and safety of Missouri children is on the line, he doesn't sit on the sidelines and think of ways to even political score. He rolls up his sleeves and gets to work. Additionally, we have Majority Leader John Patterson, who as a doctor understands the risk to Missouri children better than most, as well as Senator Caleb Rowden, who is a father of 3, is troubled by these products and the easy access Missouri kids have to them. When these leaders learn that since 2018, we've seen a 600% increase in the number of children 5 and under experiencing cannabis poisoning that resulted in emergency room visits or hospitalization, or when Missouri children under 5 went from 7 to 168. Or when Americans Poison Control Center documented that 41% of exposures of Delta 8 are occurring in children 12 and younger. Let me say that one more time. Or when Americans Poison Control Center documented that 41% of exposure of Delta 8 are occurring in children 12 years and younger. When they learned increases in poisoning are occurring in every region of our state, urban, rural, or suburban. Or when they learned that in 2024, cannabis exposure in our children are on pace to exceed those in 2023. These leaders standing with me today didn't see these concerning trends and say it wasn't an emergency. They said, Governor, how can we help put the health and safety of our Missouri children first? We signed our executive order to do just that. And I hope that by seeing legislative leaders here today, you can better understand that our executive order is not meant as a permanent fix. Our order allows us to stand in the gap on the behalf of Missouri families until such time the General Assembly can offer a legislative solution to keep unregulated psychoactive cannabis products out of the hands of our children. As I said when we announced the executive order, our guiding principle since the very beginning has been to safeguard the health and safety of Missourians, especially the most vulnerable, our children. And that remains true today. I will now turn this over to Attorney General Bailey to discuss how his office will help with this effort. Andrew?
Today, we're taking significant steps forward in our commitment to protect the safety of Missouri's children and to ensure transparency and accountability in our marketplace. Under state law, Missourians have a right to live free from fraud and deception in the marketplace. They have a right to know exactly what is in the products that they are consuming. When purchasing products, Missourians have a right to know if they will be subject to serious and potentially dangerous side effects like psychotic episodes, severe confusion, hallucinations, and other life-threatening problems. This is especially important when potentially dangerous products are specifically marketed towards children. As Attorney General, I'm committed to using every tool at my disposal to halt the sale of dangerous illicit products that harm Missouri consumers, especially children. That's why I'm pleased to announce a partnership between the Missouri Attorney General's Office and the Missouri Division of Alcohol and Tobacco Control. This partnership underscores our dedication to combating the illicit sale of hallucinogenic cannabinoid edibles that are targeted at kids and deceptively packaged to resemble regular candies. These dangerous products have no place in Missouri. History and present conditions established that these products present a danger to Missouri children. Here are a few of the examples. In March, 6 elementary-aged children in St. Louis County became sick after ingesting Delta-8 products. These were ingestible edibles. They thought that they were eating candy because the edibles were packaged and marketed to mimic candy. A 9-year-old child was so intoxicated and so confused that she had difficulty walking and believed that she was being kidnapped when her mother came to pick her up. Just a month prior to that, 4 students in the city of St. Louis were rushed to the hospital after ingesting unregulated cannabinoid products that were apparently bought and paid for at a nearby convenience store. And most recently, a pediatrician warned in the Kansas City Star that we need to do more to protect children from threats these products have caused. In a span of just 2 weeks, the doctor provided medical assistance to more than 5 preschool children who were all admitted to the hospital because their breathing and mental state was altered from eating these kinds of edibles. The pediatrician cited the packaging of high-potency edibles designed to look like candy as the cause for these illnesses. Today, we again answer the call and take decisive action with the partnership between my office and the Missouri Division of Alcohol and Tobacco Control. The first step we are taking is to create a dedicated electronic repository for the ATC to submit actionable referrals to my office. The ATC will be responsible for investigating its licensees, collecting evidence of deceptive marketing practices, and referring matters to the AGO. The AGO will then be able to instantly evaluate those referrals and proceed with legal action against licensees who are breaking the law. To accomplish this, we are creating a specialized new unit within our Consumer Protection Division that will work hand in hand with the ATC to offer legal support. The ATC will assist by making its investigators available as witnesses for legal proceedings resulting from actionable referrals. Our enforcement toolkit will be robust from cease and desist letters and investigations to subpoenas and lawsuits to referrals for criminal prosecution where appropriate. We're committed to keeping unsafe products away from our kids and ensuring that those who break the law are held accountable. I'm confident that this joint effort, strengthened by the additional resources and support we are dedicating to this cause, will lead to a significant reduction in the number of children endangered by these fraudulently marketed products. Our existing relationship with ATC has already proven to be productive, and this partnership will lay a strong foundation for even greater success moving forward. I'm grateful to Governor Parson and to his administration for their commitment to this issue and their continued partnership. With this partnership, we'll improve public safety for our children and restore consumer confidence in the integrity of products available for sale in Missouri. Today represents another crucial step toward a safer and more transparent marketplace for all consumers, especially parents and children. I'd now like to turn it over to the Director of Missouri Poison Center, Ms. Wood.
At the Missouri Poison Center at Cardinal Glennon Children's Hospital, we have seen a steady increase in exposures related to accessibility and mistaken identification by children 5 years and younger consuming cannabis. Our data shows the total number of cases have more than doubled since 2018. The Poison Center has concerns about the variety of cannabinoid products available in the state. There are several risk factors when it comes to children assessing these products. There are no federal regulations on this substance. Without appropriate guidelines for packaging, their content, quality, and safety cannot be assured. The actual chemical composition and dose may be different than what is on the package label, if listed at all. More worrisome is the packaging of these products are similar to food, as mentioned. The packaging is made appealing. It's bright colors, it cartoon images, and mimics store-bought sweets and candies. Most children eat the gummies and brownies thinking it's something okay to eat. Packaging looks almost identical to the common candy brands out there. As mentioned, in 2018, my team at the Missouri Poison Center managed 7 cases in children 5 and younger. Just last year, we saw 168 more of these exposures. Talking to concerned parents, frantic parents, because their children are not responding. we see here are scenarios where grandparents feed brownies to their grandchildren, not knowing what's in them. There's also children, as mentioned, sharing candy on the playground, at the bus stop, and then coming to the nurse's offices with symptoms. Children can experience severe symptoms because of their size and weight. So small children are higher at risk experiencing poisoning by mistakenly eating something that they think is for them and good for them. Symptoms range from mild drowsiness, difficulty walking, nausea and vomiting, to cases where we've managed with emergency departments, children having seizures, difficulty breathing, using mechanical ventilation to save them. The safety of our children is of the utmost importance, and our prevention strategy needs to be to keep this out of their hands. Thank you.
All right, now we'll open up to questions from Ms. Weber regarding the poison centers finding.
In 2022, the Poison Center reported that there was 152 cases, I believe, that were reported. They said 125 of those came from the regulated marijuana industry and only 25 came from hemp. So is the Department of Poison Control going to actually focus on this? It sounds like more of a parent's issue of allowing their kids not to take care of this stuff. If we did the same thing with guns, we wouldn't blame gun manufacturers or sellers.
Thank you for that question. Actually, the identity is really hard. So you have to understand when our hotline is managing cases, we're at the utmost focused on what is going on with the child. Often the parents don't even have the packaging. And what has been going on through the system we use to code these products is the coding has gotten better as the products have evolved over time. And so I anticipate we can see more, but what we get is not necessarily always the brand names, where these are assessed. The focus of that call is to know if they have the product, if there's some kind of listing, and then what's in that ingredient and how much, so we can either triage to keep that child at home or prevent that unnecessary visit to the emergency department. I've mentioned of those cases that have gone up, 53% of these are going straight to the emergency department without us being contacted initially because of how serious this is. These adulterants in the products are very concerning, and we really have no idea amounts or what's really in there.
Next reporter. All right, thanks, Ms. Weber.
Thank you.
Andrew Riley.
It depends on the factual scenario in each case. You know, primarily the Missouri Merchandising Practices Act is focused on civil enforcement, and that's going to be the primary effort. There are instances in which the intent of the suspect will cross the line into criminal sanction, and we'll deal with those appropriately.
So you can enforce the civil side directly from your office, but after the criminal side to a county prosecutor.
Correct.
The federal government established already the FTC and FDA a task force to actually go after these products and targeting them. That was created last year. What's the holdup for why you're going to join that? Or are you going to join that, or that task force, or is this going to be completely separate?
This is separate. We have not, to my knowledge, been invited to join that task force. This is using the resources we have available to us today under extant law, and then partnering with other stakeholders within the executive branch to again, use laws that are in existence today to add clarity and transparency to this marketplace as a principal rights issue. Yes, sir.
Mr. Bailey, what does local law enforcement play a role? How do they play a role?
Yeah, absolutely. Look, we welcome referrals under the Missouri Merchandising Practices Act to our department, to our office by any entity, individuals, law enforcement agencies. This is a special relationship between ATC and the Missouri AGO that pre-exists this issue, but by standing up a new unit and marshaling those resources to better work together, we can set a framework for ultimate success. And I know that ATC is in regular contact with stakeholders in the law enforcement community as well. So the issue, those efforts will be amplified in law enforcement circles as well.
Over here.
Are there any current plans to have educational services for parents or like schools and teachers and stuff?
Yeah, absolutely. Look, I think that as we go through this process, shining the light of truth on what's going on in the marketplace. And again, when we talk about transparency and accountability, that's really what we're referring to. You know, when you look at the pictures that have been collected by previous investigations, suckers with no warning labels at all. And so things like the press conference today, where we can demonstrate some of the bad actors, where you've got these products that are clearly meant to look like candy for children. And we talk about the health problems that these edibles have caused for children in our state in the past few months. This is just the beginning of a process to help educate the public and parents on what's really going on.
Any final questions for the Attorney General? Thank you, sir.
Let me just echo what I said before. We know that cannabis is legal in this state, but the people that we're targeting, the people we're looking for, anybody that justifies putting this on a store label and saying this is okay for a 5-year-old kid to go in and buy it. I've not had one person in the entire industry say this is okay. And I will say this, they have said, Governor, you know, why don't you let the legislators do that? You know, which I more than happy want them to do something in this session. But in the meantime, the industry has no solution to this. They've not contacted and said, hey, we're going to make sure we get all this stuff pulled off the shelves. That should be their responsibility as a business person. And I'll tell you, second of all, when you ask the question of what we can do with the local levels, somebody's delivering this product in a truck to these stores. And we need to find out who those people are that's delivering it in that truck. And then we need to find out where they got the product from. And if this stuff is coming from China or across the southern border, I will tell you somebody's going to end up being accountable, whether it's civil, whether it's criminal. But I'm telling you, it is not good for the industry to allow this to happen of what we're seeing. So I think that is just going to be an ongoing situation. But believe me, more and more parents, more and more grandparents, more people are realizing this is not good for the future of our state. And it needs to come to a stop. And I think I said early in the beginning, for the media that's here, you have an important role to play in this, making sure people are aware of this. You have probably a listening audience out there in multiple ways, whether it's print, whether it's radio, whether it's television. But you should make people aware of this just for simply as a public service that people understand we're protecting our kids here. There's no legitimate excuse for this, to what we're doing to children. We're not talking about adults. We're not talking about legitimate companies that do the energy drinks, for example. They're already regulated. You don't see them putting in a Coca-Cola can and peddling it out here. That's the big difference. We're not after those people whatsoever. We're after the people out here after our kids. That's what this whole this press conference is about. This is why we're trying to put this action into place. It's not about the legitimate operators. These people are not legitimate, whoever they are. But we're going to find all that out. Okay.
Thank you, Governor. Before we get to questions for the Governor, do we have any questions for our guests?
Yeah.
For one of our guests? Yeah. By all means.
House Speaker, almost House Speaker, almost House Speaker. We're going to do Patterson. Need a session tomorrow to anticipate the chamber.
Let me answer that for him. No.
I don't expect any overrides, but you never know. We have 163 members. They all have the ability to make motions. I don't think, at least from the Republican conference, you'll see anything, but you know, you never know until you gavel in, and we'll see. But I do expect it'll be pretty uneventful. It is. The governor called me and asked what I thought of this. I'm still learning as much about it as we all are, but one thing I think we can all agree on is that these products shouldn't be marketed towards kids, and he does have my commitment in the next session. This is something that we'll pursue, trying to provide a regulatory framework for these products, some rules in place so that they're not marketed towards kids. I think the governor, you heard him say he's not against cannabis. These certainly shouldn't be marketed towards kids, and I think the best way to do that is for the people and their elected representatives to provide some sort of regulatory framework in the legislative session. So yes.
Any other questions for Leader Patterson or our other guests here? Okay. Okay. We'll take questions now.
David, I was hoping you wasn't even thinking about veto sessions. You brought it up. Now, just so you know, I hadn't heard a thing about it till you brought that up, so if something happens, I'm blaming you for it. Yes?
Yeah, there's some Missouri businesses that say they're trying to sell these products properly just to adults without, packaging it to children. So why not regulate the packaging, the ID requirements instead of banning it?
Yeah, I think what I've seen, you do see some legitimate packaging out there. I mean, some of the stuff that I've seen, that they are trying to put places on it, safety requirements on it, and putting them in the shops and marking them to what they are. But that's not the case for everybody, and that's why I think the industry could step up and help us all a lot by just saying, hey, we're not going to allow this to happen, and there's nobody in this room that's going to justify to me to do this other than the almighty dollar. That's all it's about, is money. I've not heard one person in the industry say, yep, we're targeting 5-year-old kids. Yep, we're targeting 12-year-old kids. But when you sell it as candy, you dang right you're targeting kids. You ain't targeting adults. And we all know that. So, I mean, this is pretty basic stuff. We just need to put a stop to it.
Sir, right now we talk about the good actors. We're talking about the good actors of the Missouri hemp industry. In fact, the Missouri hemp industry website has a spot, has had it for over a month now since the executive order for them to report, because they've been working with legislators to do that, so we can report bad actors. So will you actually work to protect Missouri's good actors and the hemp industry, and work with the hemp industry, because they're actually more out there, able to see these stores better than your agents from the government?
I don't think there's any question we support both industries. They're legitimate businesses in the state of Missouri. We do it. We don't support this. I sure don't support it. So if you're peddling this stuff out there in these stores, regardless, we're not going to support that. And if you're legitimate industry, you're legitimate industry. We're not targeting that. We're targeting the people that are selling this. And I think that is up to the industry to make sure they regulate themselves. If not, then the government's going to come in and they're going to regulate it for you.
With that being said, DHS has just recently, this last week, gone into certain establishments, and actually, they were not candies like you're showing here, but they were normal products that you see out there that aren't targeted towards children. The DHS agents made that store or actually put bleach on those and destroy them. So that's why I asked the question about protecting the Missouri good actors as they do this.
Yeah, and I think that's what the legislative branch will do, but we don't have that right now. We don't have the ability to do that. That was on the last year they tried to address that issue, and they didn't address it. Whether it was the legislature or the industry. And I will tell you this, as you well know, the industry gets into it over this very issue. You know that. And that's what happens. And then all of a sudden nothing happens. And then all of a sudden that's why I took action, because I'm not going to sit around and let these kids end up in an emergency room. And you shouldn't either. You should be the first being out here saying this is wrong. The first, if you're representing that industry today.
So we heard numbers that this has increased over the last 5 years. Do you think that increase is connected to the legalization of recreational marijuana?
Well, I don't know the data to support that, but I'm sure that's going to occur, just because of that. But I don't know that that's what's really driving this. I think this is more of a marketing tool that we're using here. I don't think this is necessarily, for the people out there in the cannabis industry and the people out there that legalize marijuana, I don't think there was ever any intent whatsoever in anybody's mind to do this. I don't think anybody was out there was intending to do that and say, hey, here's a way to get, THC. I think there's thousands of other ways for adults to figure that out, and it's legal. So again, I want to go back to what I said originally. Why are we targeting children? I mean, is that what we want to do when we legalize this? I don't think anybody wanted that. Nor do I think they want that today, or they did that when they voted for it. I think they voted for it because we're adults and we can make those decisions on our own, but I don't think giving it to a 5-year-old child is a good decision.
Governor, do you think your new actions today might have a chance of being blocked by the Secretary of State's office?
No, I do not. I don't think we're going to ask him that question, but anyhow, no.
We'll open it up to off-topic questions now as well.
The lady back there has a question. I don't know if are you with the media?
I represent the industry as far as we know here, and I just wanted clarification, even more so, about packaging. So whenever you guys go in and you're enforcing, is that going to be products that good actors have that are labeled well? What's your standard for that? Or is it just trademark?
Yeah.
Because we went through the last few weeks and we have sell,
Sure.
we're proposing legislation this fall. Yeah, so I would love to sit down and talk to you about how we can help get the actual bad out.
Perfect. And that's exactly what we need. We need to be on both sides of this issue, because I don't think if you're a legitimate business like you would be, or I assume you are, and some of these stores are, this is what's hurting them. Is this what's hurting them? And we just don't have the enforcement tool in place to do that right now. Is why we stepped in. The bottom line is, if I don't do something, some 5-year-old kid or some kid today is in the emergency room again. So I'm trying to stop it as soon as I can stop it. We all should be doing that. But if I do nothing, then it just continues on until sometime next year. And I just don't want to do that. Okay. Yes?
Trevor, do you have any comments about what's going on across the street with the abortion violence?
No, we'll let the courts decide that out. It's we'll see what happens today, what they decide, and take it under advisement or whatever action they're going to take. But I think that's an unknown for all of us right now. I don't think any of us know what that decision is going to be, so we'll just wait and see.
Okay, last question.
All right. Thanks everybody for being in here, Dan.